Regular periods. The average menstrual cycle lasts 28 days, although it's normal for it to be a bit shorter or longer than this. After puberty, many women develop a regular cycle with a similar length of time between periods. But it's not uncommon for it to vary by a few days each time. Every woman is different, including their periods. Some happen like clockwork. Others are hit or miss and unpredictable. On average, a woman gets their period every 24 to 38 days. A period usually lasts about 2 to 8 days. Most girls get their first period between the ages of 10 and 15, but some get it earlier and some later. The first period is known as menarche. A girl's monthly cycle is the number of days from the start of her period to the start of the next time she gets her period. You often hear this is a 28-day cycle. But 28 is just an average figure that doctors use. Cycle lengths vary, some are 24 days, some are 34 days. And a girl may notice that her cycles are different lengths each month, especially for the few years after she first starts getting her period. A girl's body may not follow an exact schedule. It's common, especially in the first 2 years after a girl starts getting her period, to skip periods or to have irregular periods. Illness, rapid weight change, or stress can also make things more unpredictable. You may have irregular periods if the time between each period starts to change. You lose more or less blood during a period than usual. The number of days that your period lasts varies a lot. Bleeding or spotting between periods. Bleeding after sexual intercourse. Heavy bleeding during your period. Menstrual bleeding that lasts longer than normal. Bleeding after you've reached menopause. Call your doctor if you have any of the following symptoms. You miss 3 or more periods a year. You get your period more often than every 21 days. You get your period less often than every 35 days. You are bleeding more heavily than usual during your period. You bleed for more than 7 days. You have more pain than usual during a period. Unusually heavy bleeding, soaking through a sanitary pad or tampon every hour for 2 to 3 hours, or passing large clots. An abnormal or foul-smelling vaginal discharge. Vaginal bleeding or spotting between periods or after you have gone through menopause. Periods that become very irregular after you have had regular menstrual cycles. Types. Amenorrhea. It is a condition in which a woman's periods have stopped completely. The absence of a period for 90 days or more is considered abnormal unless a woman is pregnant, breastfeeding, or going through menopause, which generally occurs for women between ages 45 and 55. Young women who haven't started menstruating by age 15 or 16 or within 3 years after their breasts begin to develop are also considered to have amenorrhea. Oligomenorrhea. It refers to periods that occur infrequently. Dysmenorrhea. It refers to painful periods and severe menstrual cramps. Some discomfort during the cycle is normal for most women. Menorrhagia. Periods with abnormally heavy or prolonged bleeding. Polymenorrhea. Menstrual cycle that is shorter than 21 days. A normal menstrual cycle is between 24 and 38 days long. Polymenorrhea is just one form of abnormal uterine bleeding. Menometrorrhagia. Menometrorrhagia, defined as excessive and prolonged uterine bleeding occurring at irregular and/or frequent intervals, occurs in up to 24% of women aged 40 to 50 years. Metrorrhagia. uterine bleeding at irregular intervals, particularly between the expected menstrual periods. Metrorrhagia may be a sign of an underlying disorder, such as hormone imbalance, endometriosis, uterine fibroids or, less commonly, cancer of the uterus. Pubertal menorrhagia, excessive menstruation between puberty and 19 years of age is called puberty menorrhagia. Excessive menstruation is defined as bleeding over 80 ml per menstrual period or lasting more than 7 days. The most common cause for puberty menorrhagia is dysfunctional uterine bleeding. Other types are excessive and frequent menstruation with regular cycle, excessive and frequent menstruation with irregular cycle, excessive bleeding in the premenopausal period, excessive menstruation at puberty, puberty bleeding, irregular intermenstrual bleeding, ovulation bleeding, regular intermenstrual bleeding, perimenopausal bleeding, postcoital and contact bleeding, prepubertal vaginal bleeding. Causes. Common causes of irregular periods include uncontrolled diabetes. If you have uncontrolled diabetes, you may have irregular periods because the interaction between your blood sugar levels and hormones can disrupt your menstrual cycle. Eating disorders. If you have an eating disorder, such as anorexia or bulimia, you may have irregular or missed periods. Hyperprolactinemia. Women who have too much of a protein hormone called prolactin in their blood can have irregular periods. Medications. Certain medications, including antiepileptics and antipsychotics, can cause irregular periods. Polycystic ovary syndrome, PCOS, is caused by imbalanced sex hormones, which can disrupt regular menstruation. Premature ovarian failure. The ovaries of women with POF stop working before the age of 40. Stress. Stress hormones can affect menstruation, and prolonged stress can cause your period to be delayed or for you to skip it entirely. Other causes of irregular periods include having an intrauterine device, IUD, changing birth control pills, too much exercise, overactive thyroid, hyperthyroidism, or underactive thyroid, hypothyroidism, thickening of or polyps on the uterine lining, uterine fibroids, etc. Diagnose. Your doctor will ask you about your menstrual cycle and medical history. He or she will perform a physical examination, including a pelvic exam and sometimes a Pap test. The doctor might also order certain tests, including the following: blood tests to rule out anemia or other medical disorders, vaginal cultures, to look for infections, a pelvic ultrasound exam to check for uterine fibroids, polyps, or an ovarian cyst. An endometrial biopsy, in which a sample of tissue is removed from the lining of the uterus, to diagnose endometriosis, hormonal imbalance, or cancerous cells. Endometriosis or other conditions may also be diagnosed using a procedure called a laparoscopy, in which the doctor makes a tiny incision in the abdomen and then inserts a thin tube with a light attached to view the uterus and ovaries. Treatment. You probably don't need treatment for irregular periods unless they bother you, or if you need treatment for another condition that's affecting your menstrual cycle. Polycystic ovary syndrome, PCOS, and hypothyroidism are two common causes of irregular periods in women. In general, the goal of treatment is to restore the balance of hormones in the body. If you have PCOS, your doctor may recommend birth control pills or other hormones to trigger a period. If you have hypothyroidism, underactive thyroid, you may need to take thyroid hormones. Changing birth control. If you have irregular periods after 3 months of hormonal birth control, your doctor may recommend another type of birth control. Some women develop irregular periods when using Nexplanon, Depo-Provera, or an IUD. Lifestyle changes. Some women have changes in their period because they exercise too much. You may need to make your workouts less intense, or exercise less often. If stress is the problem, learning how to manage your stress. Extreme changes in your weight can affect your periods. Weight gain can make it harder for your body to ovulate, so weight loss could help with that. But extreme, sudden weight loss can also lead to infrequent or irregular periods. Hormone therapy, HT, and irregular menstrual cycle is often due to a lack of or imbalance in certain hormones in the body. Doctors often prescribe birth control pills, oral contraceptives, to help control irregular periods. Prevention. Try to maintain a healthy lifestyle by exercising moderately and eating nutritious foods. Make sure you get enough rest. Practice stress reduction and relaxation techniques. Use birth control pills or other contraceptive methods as directed. Change your tampons or sanitary napkins approximately every 4 to 6 hours to avoid toxic shock syndrome and prevent infections.